We're on the road. Where transportation goes, community grows. Welcome to On the Road with the MTA. And welcome to the Clean Teeth edition of On the Road with the MTA. I'm Jay Gibbons alongside with Stephanie K from the MTA. How's Stephanie today?
Well, I don't feel down in the mouth.
There we go. We got all the teeth jokes. Wait a minute. Yeah.
That's what time you usually go to the dentist. The perfect time is at 2:30.
Exactly. So in case you need to fill some time, you can just talk down.
Oh, my gosh.
Yeah, here we go.
Well, we are talking dental for a reason. MTA was so honored to be able to support this great activities going on. It's going to be a free dental day, and it's taking place on Friday, June 9th. And we are so lucky to have somebody on with us right now that can tell us more about that. Jennifer Kelly from over at the Dental Care Team. Welcome, and thank you for joining us this morning.
Thank you for having me.
Well, okay, tell us more about this great thing. Now, how long, first of all, have you guys been at the Dental Care Team? And you're located, you said, on South Saginaw Street?
Yes, we are. So we have been at this location for 30 years.
Wow.
Yep. We have been doing this event. It was originally called Dentistry from the Heart, and we are changing it this year. We're kind of branding it as our own. So it's called Smiles on the House. It is a free dental day. We do cleanings, fillings, and extractions for anyone in need.
So do you have to make an appointment for this? Is it walk in? I see it says first come, first serve basis. Do you just walk in the day up?
First come, first serve basis. We start registration at 7:30 in the morning. Our goal this year is to service at least 200 patients if possible. And if we can do more, great, but our goal is 200 people.
Wow. That's a lot of people. So in the years past, have you been filled right out and had to turn people away, or how did it work in the past?
Fortunately, we have never had to turn anyone away.
Good.
The first year we did it was our busiest. And I think we ended with 225.
Oh my gosh. How rewarding to know you're helping people that can't ordinarily afford that.
Yeah, it was new for us. So we didn't really do a cutoff. So we kind of learned our lesson, and now we do have to have a cutoff because trying to service all those people, we have to have a start and finish time.
Absolutely. Well, Jay just mentioned you have two locations. We talked about the one on South Saginaw Street by the high school, but you said there's also one on Dort Highway on Hill Road between Dort and Potter?
Yes, we do have one there too. It's a little bit smaller office, but our South Saginaw Street, that is where the event will take place.
Great. And I know MTA is providing some transportation. I know Dennis Hirschberger said he's driving an MTA car. Where can that be located? Where is he going to be coming from?
So we are limited parking at our building, but Ace Hardware in Grand Blanc, they always let us use their parking lot. We're very grateful to them. So Dennis will be shuttling people back and forth from Ace to the office.
So Ace Hardware, that's over there by the Bug Plaza where like the Kroger is located?
Yep.
Kind
of tucked back right by Kroger.
And so tell us exactly where you're located on South Saginaw Street so they can find you.
We are just north of McCandless Road. We are right next door to the courthouse on Saginaw Street. Our building is literally right next door.
Is there an address?
It's 8189.
Perfect. All right. They can just put that in their Google. They can just GPS that one.
Yep.
So is it all ages?
It's all ages.
Wow. That's really impressive. I mean,
that is good. So how many kids do you usually get in there?
I feel like the last year we did it was our highest with kids. And I feel like we probably seen maybe 20 kids.
Now, is there an age cutoff?
There is not. No.
Okay. So you can bring any kid.
Mostly adults because of not having insurance or, putting things off. Usually the kids are pretty good. But we did see quite a few kids the last year we did it.
Well, I know a friend of mine who said they just started coming to you and they thought that you were so patient and kind. And she said she was very pleased with the services there. So I know you do a good job every day of the year. And this is this is a special day for all to be able to take advantage of this one.
Yep.
It is. Yes.
And you might have some new clients out of this. When they come in and see you, they might think, I'm going to start going there forever now.
Yeah. We have in the past, we've had people come to the event and then before they leave, they sign up for their new patient appointment.
Oh, good. That works out well. I know I was talking to you about, we're going to be serving some popcorn at our 50th gala, which is taking place actually Saturday. And you had said that you'd be willing to give us some dental floss for those that have the popcorn stuck in their teeth. Thank you for that. That's going to be ever so appreciated, let me tell you. So how important is it that you do floss every day? Is it every day or maybe once a week? How important is the flossing?
It's very important, at least once a day.
Really?
Yes, that's what we recommend, at least once a day.
Now,
I feel like that's the biggest thing that people put off is their flossing.
Yep, I'm going to raise my hand. Yes, I'm terrible at it. I usually not as often as I should, but I still, but my dentist says I have a great mouth, so I'm good.
Doesn't your wife work at a dental office?
Yes, she does. Yes, so I'm very familiar with dentistry from the heart, and obviously my wife's been in the industry for 35 years.
Wow.
So I think it's wonderful what you guys are doing. I think it's now you're calling it tooth on the house, tooth in the town. What was it?
Smiles on the house. I love it.
Smiles on the house.
Okay, now that we're talking about dental flossing every day, which I thought it was just maybe once a week or so. I didn't know it was every day because sometimes they bleed because it's like it hurts when they dental floss. My teeth are so tight that if I get up in there, sometimes it hurts my gums. How do you keep that from happening?
It means you're chewing too hard.
Well, if you're flossing every day, it should lessen the amount of bleeding that you have.
Okay. Now, what about the toothbrush? Are you supposed to replace them every 6 months, or how often should you do a new toothbrush?
Yep, 6 months for a manual toothbrush. And then if you have an electric toothbrush, we usually say about 4 to 6 months for the heads to be replaced.
And of course, I'd prefer an electric one. Those work great.
Oh, they do, don't they?
I like those.
So why replace them sooner with the electric than with the manual?
It works harder.
Oh.
I'm not really sure, but that's just what they recommend.
And do you recommend the water picks over the brushing?
Yes. Well, not over the brushing, no. In addition, if you're not a big flosser, we recommend the water picks.
Do you use a water pick, Jay?
We have one in the shower. Yes, we do.
It seems to me like it make a mess. Doesn't it splash
It does,
everywhere?
but if you do it the right way, as my wife showed me how to do it, you got to kind of put it in your mouth and kind of do the water irrigation system, and boop, done.
I guess I got to try that one. All right.
Yes, you got to get better.
I know.
You want your teeth the rest of your life.
I
so
do. That's true. Okay, now, Jennifer, another question. Does it matter if it's a soft brush or a hard brush bristle? Sometimes they say the softer ones are better for your teeth. Is that true?
Yeah. The toothbrushes that we give at your cleaning appointments are soft.
Okay. And as a kid, we were taught not to go up and down, but to go in circular motions. Is that still true, too?
It is, yes.
And how about the use of mouthwashes? Is that always a good idea? Non-alcohol based or?
Yes. For the kids, we definitely recommend a fluoride mouthwash. The adults, it's kind of your preference, but absolutely, it's always a benefit.
And I was asking you off the air, but I'd like to ask you on the air as well. Is it dangerous? Is it okay to use those little whitening strips? Because I like to use them once in a while, but I don't want to overuse them. Can it hurt the enamel on your teeth?
The whitening strips are okay. We actually sell those in the office. And most of the time we recommend, as long as you're not having any sensitivity, you're okay with using them how often you want to use them.
Well, I went to buy some. They said, well, do you want the 10 times strength, the 2 times strength? And that's like, I don't know the difference. The price.
Yeah. The higher the number, the more hydrogen peroxide that's in it. So if you're doing it more often, I would go with a lower percentage.
Okay, now that you mentioned hydrogen peroxide, what about just rinsing your mouth out with hydrogen peroxide? Would that do the same benefit?
I don't think so.
Okay.
I don't think it's mixed with like a whitening agent. So.
Oh.
And I'm assuming that if you use those things too much, it could damage your teeth.
It can cause sensitivity, yes.
I don't like sensitive teeth.
I don't either. If you use the whitening strips too often, you say?
Yeah, that's what I'm thinking. I would guess that you use them too much, it's going to damage your teeth.
That's what I was afraid of. Yeah. And you can't get that enamel back.
Exactly.
No.
And don't chew on nails. That's not a good idea.
No.
No. Nails, ice, none of that.
Oh, yeah. People chew on ice all the time. I see them doing that. It's bad for your teeth, huh?
Yep.
Yeah.
Yes, it is.
Oh, well, I was eating a milk dud one time. I know I shouldn't have been. They say you're supposed to suck on those and not chew on them. I have to chew a milk dud. And I was watching the $1 Million Baby movie, and just as she got punched and her tooth fell out, my filling came out because that milk dud pulled it right out.
Wow.
Exact same time. Like, oh, no, my tooth.
Oof, that hurts.
So there's certain foods you probably should not chew on, aren't there?
Yeah.
Darn it.
So are there any services on the free dental day that you do not do?
Yes. So we're not doing any crowns, any root canals. I know we've actually had a couple of people call and ask that. We are strictly doing cleanings, fillings, and extractions. Those are the 3 services we're offering that day.
Okay. Well, you probably wouldn't have time to do a root canal. That's expensive too.
No.
No kidding. So, okay, any word of advice to keep people keeping their teeth in their mouth? Okay, you said to make sure that you brush, twice a day, 3 times a day? What do you recommend?
At least twice a day. Floss at least once a day. That's going to keep your teeth and gums in a healthy condition.
Any preference over the regular dental floss? Those little sticks, they have like little wire on them, like the little sticks?
No, that's completely your preference.
Okay.
I know I can ask you about gingivitis and how common is it?
I mean, it can be fairly common if you're keeping up on your regular cleanings, you're doing your at-home care, you should be in the clear. But if you're putting things off, you're always at risk. You know
what I appreciate too? Last time I went to the dentist, a couple times, they will take a light inside of your mouth and they look at your tongue and they can detect if you have cancer just by the look in your mouth.
Yes.
Yep. Yes. We do cancer screenings for our new patients also. Yep.
That's impressive. Do you also do the Zoom whitening there?
We do opalescence. It's similar. It's a little different. But that's the one that we use is the opalescence. Is
it less expensive or more expensive than the Zoom? The Zoom was like $500 last time I looked.
It's less expensive.
Oh, good.
We charge $299 for our in-office whitening.
Oh, good to know. Okay. And how long would that last, would you think?
It should last quite a long time. You do the in-office with us, and then you do get some strips to take home with you for your at-home care, and then you can purchase more as you need them. But I feel like it lasts a pretty long time.
So do you think tea or coffee is more damaging when it comes to staining the teeth?
If I had to choose, I would say coffee.
Coffee's more damaging? Darn, because I love coffee.
Oh, do you?
Yeah.
Yeah.
What about red wine? That's bad too.
Red wine too. Yeah. That one you better brush your teeth and tongue too.
Clean your teeth too.
Yeah.
Darn it. They say if you
the trick is to drink it out of a straw.
Oh, there you go. I can do that.
Jennifer, I'm sure you can elaborate that oral systemic health. You can obviously, since your mouth is the gateway to your immune system, you can catch a lot of things by going to the dentist. And how often should someone actually see a dentist?
Yes. If you're staying regular, twice a year is what's recommended. It's very important. I mean, your oral health leads to other issues. You can have, heart disease, stuff like that. It's all connected. So if you're up to date, we recommend at least twice a year to come and visit us.
Because you can detect other things in your body by your mouth, can't you? We can see if you're having some liver issues.
Yes, absolutely.
Well, good to know, Jennifer. Thank you so much for this invaluable information. We are definitely going to mark our calendars for June 9th from 8 a.m. until 4 p.m. And that is at the Dental Care Team on 8189 South Saginaw Street. Is there a phone number they can call if they wanted to make an appointment to be seen by the dentist?
Yes. Our phone number is 810-695-1151. And then you can also make an appointment by going to our website, and it's just dentalcareteam.com.
Perfect. Well, thank you, Jennifer. And I'm so glad MTA is going to be supporting that, and they'll be there as well.
Yes. Thank you so much for having me.
You bet. And thank you for the dental floss. I'll get with you to pick that up. That's going to be so welcome after popcorn.
Means I'm eating popcorn on Saturday.
Yeah. And go home with your dental floss.
Yep.
Yes.
Well, thank you so much. And thank you for listening. And please feel free to listen each and every week as we bring you On the Road with the MTA, Stephanie K. and Jay.
That is me.
We love bringing you community information. Thank you for listening and stay safe.
You've been listening to On the Road with the MTA. For more information on our services and community outreach, visit us online anytime at www.mtaflint.org and be sure to follow us on Facebook, Twitter, and YouTube. The MTA, your community, your connection, your way.